Public Affairs programming on WQPT is brought to you by the Singh Group at Merrill Lynch, serving the wealth management needs of clients in the region for over 25 years.
Open enrollment begins under the Affordable Care Act. What you need to know during the few weeks you need to make a decision. And the Botanical Center is opening its doors to artists and people looking to get away from winter in the cities. The Affordable Care Act, known as Obamacare, has neither been repealed nor replaced. It also has not been promoted nor allowed to prosper. So millions of people are entering an open enrollment period with more questions than answers and more uncertainty about how they'll pay to stay healthy. It's never been clearer that thousands of people in Iowa and Illinois are at this very minute caught in the middle of the war over health care. Joining us are two men in the thick of the ongoing debate, of course, the President and Chief Executive Officer of Genesis Health System, Doug Cropper, and the Chief Executive Officer of Community Health Center, Tom Bowman. Gentlemen,
thank
you both for joining us. Let me ask you, is Obamacare effectively dead?
I don't think it's dead yet. I think it eventually will be modified, but it's certainly not as healthy as it was when it started, or as it was a couple of years ago. But I don't think it's going to go away completely, no.
Well, but a lot of people are worried only because they're seeing, the expenses go up, their options go down. That's not necessarily a good system when we were promised such a better health care system.
Oh, there's no question. But remember, the Affordable Care Act did a lot of things. It both modified the way insurance worked. I don't think those modifications are going to change. For example, that children up to the age of 26 can still participate in their parents' health plan. So there was that piece.
Very popular option.
Yeah, very popular option. So there was all those insurance modifications, lifetime maximum, no pre-existing conditions, as well as Medicaid was expanded dramatically. Now that may or may not be modified depending on what happens, and that was certainly a big part of the debate. And then the real big piece was looking at the individual market. That's certainly been troubled and troublesome, and that's the part that's the least healthy right now, is the individual market.
Let's talk about that, Tom, because the open enrollment starts right now, but it's not that long of a period of time. People are used to a much longer enrollment period.
Yeah, the previous administration had allowed for a longer enrollment period. This administration has decided to stick to the letter of the legislation and have it be a 45-day period. So people will have to go out and go to healthcare.gov and find a plan that works for them. It'll be fast and furious.
Are you worried that fewer people will do that this time around?
I am worried. I think there's a lot of talk about whether or not it's going to be mandated that people get coverage this year. I think there's tweets today about that, maybe trying to pull back on the individual mandates. So I think people are still wondering, do they need to go out and get the insurance, but also what is available to them, and they hear about premium increases and those types of things makes them very uncertain about what's going to be available for them.
In many different ways, hospitals and other medical professionals have really been in support of the ACA as a way of helping make sure that Americans get healthier. Have we noticed, Doug, any change in the health of the Quad Cities when it comes to the ACA? Has it lessened your ER visits? Has it made the area more healthy?
There's no question. There's about 15,000 people who have signed up for some form of coverage that weren't covered before. Those are the estimates within Rock Island County and Scott County in the Quad Cities. Yes, significantly. I think first of all, we have anecdotal stories from our physicians and navigators of people who weren't covered before and are now covered, or who were going to lose coverage. Let's say someone had a pre-existing condition of diabetes and was going to be, they weren't going to have a plan option, and now they have a plan option and they can get diabetes care. Do we see our emergency department visits go down? Have we seen all of those things change? Not as dramatically as I would have expected, but there's no question that for those 15,000 people, their ability to access primary care, wellness visits, whether they're adults or children, has improved things dramatically, and we have evidence towards that.
Well, should we have expected a change so quickly when you're accustomed to a certain way, or you're accustomed to stay away from medical professionals, or only visit you when it becomes the very worst thing? Would that be so surprising that in the period of time that we've had Obamacare, that there haven't been these transformative changes in how we seek medicine?
Now, change doesn't happen overnight in most things, unless it's the adoption of the iPhone, right? But
very true.
if you look at it, I think it's hard to break cycles if you're used to going to the emergency department and now you're going to link up with a primary care physician, as well as a lot of young people are quite healthy and they haven't established a relationship with a primary care physician. So this is starting just to get traction. Both Tom's operation and Genesis Health System, we have a medical home model, we have a team-based care model. We're working hard to connect with people to make sure that they have primary care doctors, et cetera. That's what's really going to change healthcare. So,
community health, of course, such a huge safety net for people in the Quad City area seeking, as we were saying, dental as well as medical health treatments. How has the ACA changed your operations or strengthened it in any way?
Yeah, I think it's definitely strengthened it. We've seen so many more of our patients, many of whom fall below 200% of poverty. We're actually afforded coverage through Medicaid expansion, and that has been a big driver from the ACA for us. The thing that I think it does for us is it allows us to provide services to those patients that maybe we weren't able to before. A great example, behavioral health care. We're able to integrate behavioral health services because we have a coverage option for those people so that they can get access to behavioral health services now as part of those preventative services. You know, one thing we talk about driving down ER usage and that kind of thing, one thing the ACA didn't do is create more doctors. And so even though we want more people seeking preventative services, you have more people that have coverage, and you know, when they are sick, they are maybe going to the emergency department because we still don't have enough primary care physicians available to serve everybody. And that's something, again, that will get better over time, we're hoping.
Do you think a lot of people in America, and we were talking about Congress in particular, that the mindset is now there, that something has to be there? Because we keep talking about repeal, but then the critical replace, which is not something we were even talking about 10 years ago. There was no replacement because there was nothing there.
Right.
I mean, has that mindset at least changed as far as the American public is concerned?
I think so. I think people that were able to get coverage, and now when they have had a maybe an accident or an episode and they're not going to be facing medical bankruptcy or something along those lines, they see the value of having coverage. You know, I think Doug had mentioned it's once people have had it, now they view it much more favorably than they did previously when we were having a discussion about whether or not to endorse the Affordable Care Act.
So Doug, when you're talking about the replacement, let's go there for a moment. It seems like, because let's be honest, the ACA was a sweeping piece of legislation.
Huge, yeah.
And one wonders, should you take baby steps instead? But then you get a piecemeal approach, and anybody can kill any part of that piecemeal. Do you think that's what's going to happen? I mean, we've repeatedly tried to do this wide-ranging change of the ACA. Is it going to be that you're going to only be able to change portions and keep the popular parts?
Well, I've stopped trying to predict what's going to happen in Washington.
Very, very good.
But I think logically, it is such a sweeping change that it's hard to take the whole thing and repeal it and replace it in one big swoop. It makes sense that we would refine and perfect parts of it. Like, for instance, we could be working right now in Congress to look at the individual market and stabilize it, and make sure that those premiums are affordable to those people who have no other health care option other than to buy, you know, coverage on the individual market. So that would be an easy piece to go after. We can also look at exactly how many people we're going to cover on Medicaid and Medicaid expansion. I think it's almost easier to take it in pieces, but it's hard to predict what's going to happen in Washington. And the one thing I would say is, unfortunately, it's gotten very political.
Well, and very personalized, because it has,
Exactly.
you know, it's attached to one person in particular,
Yes.
one administration in particular.
Which has probably prevented it.
I would think so.
The politicization of this has prevented it from being kind of a rational approach to try to improve it.
So open enrollment has started, Tom. What are you telling people? I mean, we've got people that can help people get enrolled, but the campaign to get enrollment, the public information is going to be far less available than it was in years past.
Yeah, I mean, I think we're advertising through social media and through our patient encounters within the clinic, and encouraging them to talk to their family members, word of mouth. You need to go out and get enrolled. We're telling people that there's still plans available. They really need to go to healthcare.gov. We're there to assist, so if they need help navigating that system, we're there to walk them through that process. I think more than anything, we're telling them between now and December 15th, it's business as usual. If you need healthcare, go to healthcare.gov and find a plan that works for you.
Are you worried way too many people aren't going to do anything until December 13th and 14th?
Yes.
That's very traditional, too.
Exactly. We see that every year. People wait until the last minute. So we hope they'll be more proactive, but we anticipate probably a surge towards the end of the period.
What type of help does Genesis Health and other medical providers in this area, what kind of help are you giving to people who are looking during this open enrollment period?
We have navigators as well, and that can help with this, as well as people within our emergency department and our billing departments can help people get to the right place. We want to provide all the help we can to make sure people have coverage, because healthcare access begins with coverage, and that's what's been great about the Affordable Care Act, because it increased healthcare coverage for millions and millions of people.
But it worries you that the options that are available to Iowans in particular, but Iowa and Illinois, and the cost increases that they've seen over the past, that have been announced for the upcoming year, and that's going to drive some people just to take the risk and not be insured.
Well, no question. And because the penalties, and it's even unclear as to what's going to happen with the individual mandate, because those penalties weren't really high enough to force anybody to get coverage. There wasn't a big incentive unless you needed health care and you knew you were going to be sick. And that's why the cost in the individual market is so high, because it's only those people who knew they were going to use it, probably at a high level, that are purchasing it, which makes it very expensive for now the one company that's going to be offered. So, it's a little bit like fire insurance. If you only had to buy fire insurance when your house was burning, fire insurance would be pretty expensive. So if you go back and say, why isn't the individual market working? Well, it's for those reasons. But I worry that fewer people are going to purchase on the individual market because it's so incredibly expensive, and we only have one offering. What if that company, Medica, pulls out in Iowa? You've got some serious issues there.
So Tom, grab your crystal ball. I mean, the Republicans tried to repeal and replace at least 2 times, during this past session. What does 2018 bring? I mean, obviously uncertainty at this point, but doesn't it almost have to be a decision has to be made within the next 12 months?
I think you'll see each part. As Doug mentioned, there's different segments to it. I think the administration has signaled that they want to do something different with Medicaid, doing block granting. I think that will come back this coming year.
That certainly seems to be popular as an option.
Yeah. It gives caps on the spend from the federal level, but puts a ton of pressure on state budgets, and so that'll have some challenges that go along with it. Certainly, the individual marketplace will continue to have challenges, depending on whether or not people are mandated to purchase insurance or not. But one thing I would tell anybody that's going out on healthcare.gov is remember, those that fall below 400% of poverty still will have some subsidies and some premium support for their plans. So although there is increases in the premium amount, they will still get some tax support from that standpoint.
And the only way you know is if you ask and if you find out, and there is help available, and don't pretend that there isn't. There is. You just got to take that first move. Right. I don't want you to leave without first asking you, Doug, about your added responsibilities coming January 1st, joining one of the trustees of the American Hospital Association. This is going to be a critical, that's a 3-year term, but this is going to be a critical 12 months for the AHA.
It is, no question. And there's so much uncertainty in healthcare, but I really appreciate the opportunity to serve at a national level. There's about 20 of us on the American Hospital Association board, and I was chosen to do that, and I'm really honored.
What do you hope to be able to accomplish during your 3 years? I mean, that's a pretty wide open question, but I mean, there must be something in particular that really interests you in getting accomplished.
Well, there's very few people on the board, maybe none other than myself, that have responsibility over a rural area. So I really hope to represent rural areas from either Iowa, Illinois, or I used to work in Minnesota, so I have a rural perspective, as well as just be kind of a voice of reason as we advocate for trying to change and make positive changes within healthcare and make it affordable would be the other piece. So.
Well, and let's be absolutely honest, is that the rural hospitals have some of the toughest abilities to stay in business, and yet it's the only option for so many people in America.
Exactly. We have services in DeWitt and Maquoketa as an example, and having healthcare access, we're talking about access in those areas. What if that hospital wasn't there? Lives would be lost trying to transport those people down to an area like the Quad Cities or up to Dubuque.
Doug Cromper from Genesis, Tom Bowman from the Community Health Center. Thank you both for joining us. We do appreciate it. And once again, it's important for you to make sure that you find a way to get enrolled. Open enrollment only lasting 6 weeks. Get the information. You will need it. Well, we're entering November with a full calendar of events heading into the holidays, and Laura Adams has some great suggestions if you're ready to get out of the house and go out and about.
This is Out and About for October 30th through November 5th. Hi, I'm Laura Adams. A screening of Good Earth, Awakening the Silent City, a new documentary by Fourth Wall Films, is coming to the Putnam Museum's giant screen November 5th at 2. The annual Fall Antique Spectacular Vintage Market is November 3rd through 5th at the QCCA Expo Center in Rock Island, featuring 70 exhibitors with antiques and vintage items galore. Western Illinois University Quad Cities is holding an English Language Learners Conference November 4th. Illinois public school teachers are eligible for 4.5 professional development hours. Or be in the audience for Quad Cities Go Red for Women's Luncheon at the River Center on November 1st. Festivities will be held on October 31st at St. Paul's Lutheran Church in Moline to mark 500 years after Martin Luther posted the 95 Theses. Experience our seasonal changes on a guided hike along the trails of Nahant Marsh the first Saturday of the month. The Cordova Art Artisan Market features 30 juried regional artists November 4th in the Cordova Township Civic Center. Fine arts, wooden bowls, music, and much, much more. The Second Chance Sale, Shop for a Cause, supporting Dress for Success Quad Cities, is coming November 4th. Buy new and gently used brand name attire and accessories at bargain prices. Plus, there's still time to catch Ring of Fire, the music of Johnny Cash at Circa 21 in downtown Rock Island. For more information, visit wqpt.org.
Thank you, Laura. Louis Knudsen just released a brand new song that mixes a little R&B with pop. Check out his Facebook page to get a taste of what he's up to. But we caught up with him on the stage of the River Music Experience when he performed another of his songs. Here's Louis Knudsen with Sing to You.
Burdens, all my chains are gone. Whoa, whoa, whoa. Now all I have left is a heart so full of songs. Pain is all gone, and I'm gonna sing to you. Said my pain is all gone, and I'm gonna sing. Said I'm gonna sing to you. Out from the sand and the mud. Whoa, 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 whoa. Now all I have to lift is a heart so full of love. Whoa, whoa, whoa. Oh, my to you. You are standing right beside me. I'm not alone anymore. Whoa. In you, I have all I was waiting for and more. My loneliness is gone, and I'm gonna sing to you. My loneliness is gone, and I am gonna sing to you. So why should I not be glad? Why should I not be glad? I am free from my burdens, all my chains are songs.
Louis Knutson with Sing to You. Our first big frost of the year has come and gone, and now your yard looks like it needs a good raking. The plant's last blooms are long gone, and everything is turning from green to brown, except at the Quad City Botanical Center. But it's more than plants on display inside the walls of the center. And joining us is Ryan Willey from the Botanical Center in Rock Island. And this must be kind of one of those times of the year where you're afraid of being forgotten, because everyone thinks, oh, all the plants are gone. There's nothing to see.
Most definitely. Typically, botanical gardens aren't something people think of in the winter. We're there, and quite frankly, it's warm inside our building.
Well, and it's kind of an oasis, too. I mean, if you get tired of the winter scene, what a great way just to step indoors and get the lush surroundings.
Absolutely.
How difficult is it to keep the Botanical Center lush, as we were saying, during the winter as opposed to the other seasons? Is there no real difference?
I don't know exactly. That would be something the horticulture staff
Sure.
would be better off to answer, but they do a great job.
Yeah, that's
it is
definitely true.
challenging to keep the sun garden, the atrium heated, and the humidity is obviously a huge factor in the health of the plants, but they do a great job monitoring that, and even more importantly, staying a step or two ahead of the weather.
Well, let's talk about why you are here.
Sure.
And it has to do with a kind of a call of action to artists from around the area, because not only do you want to display plants and nature, but artwork as well, and a perfect blend. So what are you looking for right now for the Botanical Center?
We're looking for any type of artist, really, within a 300-mile radius of Rock Island. Typically, we display 2D art, but we're open to anything, sculptures, 3D stuff, anything we can display reasonably within the boundaries of the Botanical Center is what we're looking for. And typically, we like to see people who use nature as their inspiration for their art.
And how will it be displayed? I mean, is it during a certain period of time? I mean, how do you plan on doing this?
It's a month-by-month basis.
I
So
see,
each
okay.
month we have a new artist that comes in. We'll have an opening reception. You know, we'll advertise that their stuff's available to see and purchase at the Botanical Center. So it's a month-to-month thing.
So you submit your artwork, and then what happens? You've got a jury of peers that takes a look at
We
what
do.
should
We
be-
have an art committee. You submit your artwork. You have up until January 15th to do so.
All right.
It's an online application, so you don't have to print and send anything to us. No sending thumb drives or anything like that. It's all online. You can find it through our website. and you apply on an exterior website, so it takes you to somewhere else, and then we jury the work and let everyone know by the 20th of January.
What have you liked that, because this isn't new, of course, I mean, you've been doing this for a while, but I mean, it's kind of a neat way to get the expression of artists out into the public, and a public display anywhere is fantastic.
Yes.
What have you seen over the past year that you really appreciated?
I've seen all kinds of cool stuff. It's
so.
tough to narrow it down, especially since I don't have an artistic bone in my body. It's cool just to see the different talents that people have. Photography is very popular and something I think is very different depending on who takes the photo and who edits it, so I think that's unique to see. Anything nature related I enjoy.
Yeah, and it just kind of all blends together even when you don't think it might blend together.
Yep.
I mean, it just works out really nice that way. I want to talk about some of the events that are going on right now at the Botanical Center as well. You've got the Sunday Family Fun Day, and this month it features the Snowflake Fun. It's coming up actually this Sunday.
Yep.
How has that progressed? I mean, that's a great activity for the family.
Sunday Fun Days are one of our most popular events that we have. It's the first Sunday of each month. And there's a different theme that's seasonally based, and to be clear, we're not celebrating winter in any way, shape, or form. We're celebrating the wonder of snowflakes, and families can drop in anytime between 1 p.m. and 3 p.m. The program's covered with general admission. There's a craft, there's a take-home craft, there's activities, and on Sundays we also have our railroad garden that runs, weather permitting, so that's just an added bonus for families to enjoy.
Is there an age group that it's really pointed toward?
We see 5 all the way up to 95 come and enjoy.
There you go.
Yep.
That's exactly
That's great.
Now you also have your ongoing Kinder Nature series this year, or this month I should say, and that's on Tuesdays.
That is the second Tuesday of each month, and again, seasonal theme. There's a craft, a lesson, and a themed snack as well, and that's for 3 to 5 year olds.
And that's what's kind of neat. I mean, a little bit surprising too, because it's that young, 3 to 5 year olds, but there's a reason why you've invited them.
Yeah, they really get into nature, and when you can catch them early and teach them the importance, it's great. And our education director, Greg, does a great job of interacting with the younger kids, and we see a lot of grandparents that are the caretakers of children while the parents are at work. We see daycare providers. It's fun to watch those little kids walk in through the center and enjoy an hour of learning.
Yeah, because I was going to say is that anything that you can get, any activity that you can get for parents and guardians to take care of these kids, I mean, it just really helps them learn something while having a lot of fun.
Sure does.
And that's pretty much the mission.
That's it.
Tell me about winter at the Botanical Center, because you really do want people to come by and make the most out of the programs, the services, and the displays that you have.
We do. Actually, this year, for the first year, we're doing a holiday light display. So the month of December, we're going to have our gardens decorated with holiday lights. It's going to be unique. It's going to be fun. It's our first year, so we really hope people come out and just see what it's all about, and hopefully it'll become a tradition for some families.
And when does that time start?
That starts December 1st and goes through the 31st.
So that's going to be great for anybody who wants to get a little bit of Christmas spirit without necessarily freezing.
Yep, it's warm, I was going to say.
Ryan Willey from the Quad City Botanical Center, thank you very much. And once again, if you're interested in getting your artwork displayed, what do? Go
to our website, go to the artist page, download the call for entry, read it, follow the link to the submission page, and take it from there.
Thanks, Ryan. Have a very warm Christmas.
You too. Thank you.
WQPT is already planning for your new year. Tickets for our biggest fundraiser, Champagne on the Rocks, are now on sale. And join us at the Damport Outing Club Friday, January 26th for dinner, an auction, and a chance for you to win a very fine piece of jewelry. Head to our website, WQPT.org. See some of the items that could be yours. And we hope to see you at Champagne on the Rocks, January 26th at the Outing Club. We're telling you now because tickets are available. Plus, you got to put it on your calendar so you can look forward to something in the new year. On the air, on the radio, on the web, and on your mobile device. Thanks for taking some time to join us as we talk about the issues on the cities.
Public Affairs programming on WQPT is brought to you by the Sing Group at Merrill Lynch, serving the wealth management needs of clients in the region for over 25 years.